There are many different sources of low back pain. Sacroiliac joint pain is one of those sources that I see patients present to me with. Let's talk for a second, what are sacroiliac joints? Sacroiliac joints are the junction between the sacrum and the two iliac bones. The sacroiliac joints actually are in the pelvis, but it is an area of transition between the upper body and the lower body. This is where the weight and the forces are transmitted from the lower body up as well as from the upper body down. These joints are quite complex. They have a very convoluted contour as far as their surface is concerned, and they move on at least 3 axes. So there is a significant amount of movement. However, that movement is relatively small. If, however, that movement is affected in any way, whether to increase that movement or to block it or decrease it, one can feel pain stemming from those joints. That usually starts inflammation, where we define it or call it sacroiliitis. Now, the pain coming from the sacroiliac joints can be referred to as sacroiliac joint syndrome, sacroiliac joint pain, sometimes just sacroiliitis. What most people will feel is pain that is below the belt line. It usually is described as in the buttocks, and at times it can be on one side, or commonly it can go across the buttocks. The reason I say commonly is not because both joints are usually involved, but usually because people wait until it starts to involve both joints. Because when one joint is involved, it'll start changing the way we walk. And as we start to compensate and shift our weight, it starts to aggravate the opposite joint. And so very commonly I will see people with predominantly one-sided pain going across to the other side already. That pain usually can be aching, it can be burning at times, and although as a joint we would expect it to be localized to the area of the joint, it is very commonly going to refer. When I say refer, what I mean is that pain is going to travel, and when it travels, commonly it'll travel down the back of the leg, sometimes into the thigh. Occasionally it can actually mimic a sciatica. So it can mimic a nerve-mediated pain that shoots down the leg. It's not going to go as far as the sciatica usually does, but it can mimic it, and some people will come in saying, I think I have sciatica, where in reality what they're actually suffering from is a mimicking pain coming from the sacroiliac joint. Very important in diagnosing the sacroiliac joint is to listen to the symptoms. Because most of the times the patient will reveal everything that we need to know as far as what the etiology of the pain is. Most commonly, this pain is going to be localizable, as I discussed. It is also going to be aggravated with standing, transitioning from sitting to standing, such as getting up or down from the chair, the toilet, at times getting in and out of the car, and also at times it'll wake people up out of sleep when they're trying to turn in bed, because that is also where the forces are transmitted through the pelvis. The sources of the pain and inflammation in the sacroiliac joint, as I mentioned, is due to the alteration of the actual motion of the sacroiliac joint. It can be traumatic, so in other words, a slip and fall landing directly on the sacrum can cause pain to start in the joints, inflammation to start in the joints and causing the pain. Sometimes a shearing moment through the joint can occur when a situation occurs when one is walking and then steps off a curb without realizing it, and then shearing moment is created through the sacroiliac joint. Non-traumatic sources of pain can be inflammatory or arthritic. So inflammatory, there are many different types, such as ankylosing spondylitis, etc. And arthritis, just normal wear and tear, osteoarthritis of the joints can also occur in the sacroiliac joints. Pregnancy, that's another reason why people may have pain stemming from the sacroiliac joints, because in preparation for delivery, the body will loosen up the ligaments, allowing a lot more motion around that sacroiliac joint. And even though we expect that to come back into normal function, sometimes it just doesn't. And at times, the pain will persist, and it'll persist sometimes for years. I've seen patients that come in with 3-4 years of pain, sometimes debilitating pain that prevents them from walking. So, then how do we diagnose? Well, the first thing, like I said, is the symptoms. Second is the signs. Clinical examination plays a significant role. In one way, it plays a significant role to rule out any other reasons to have pain, because sometimes sciatica is really sciatica, but you need to rule those out. So examining overall for any other sources of a similar pain. Of course, to mention, I need to be aware of the fact that there are other sources of this pain that may need to be looked at that are not the common sources of low back pain. So even though this may seem straightforward, it's important to rule out every other source of low back pain. Clinical examination and the symptoms will comprise a significant portion of the diagnosis. Then, sometimes it is necessary to obtain imaging. X-ray, CT scan, MRI even sometimes, although not commonly for sacroiliac joint pain, are needed. It all depends on the current situation and what the suspicion is for the source of the pain in order to rule out that source and also conclude or bring us closer to conclusion of this stemming from the sacroiliac joints. Once all of that is obtained, a final diagnostic tool that we have is a directed block of the sacroiliac joint. This is done under fluoroscopic or X-ray guidance, where a small amount of medication is deposited into the joint itself. If that reduces the pain, then that confirms the diagnosis of the sacroiliac joint pain, of course, having been brought to this conclusion by all the previous steps. This also can serve as a therapeutic modality. In other words, reducing the pain and reducing the inflammation can help function better. But as I mentioned before, the function may really be affecting not just the pain localizable to the buttocks, but also it may be shifting the gait. And the way we walk will affect other joints. So normalizing that is very, very important. Physical therapy becomes a very important component of this. And that usually will be focused on targeting the areas that usually have either predisposed or are necessary in order to get someone out of this trouble. Hip stabilizers are very important. Core stability is also very important. So normalizing the motion of the sacroiliac can be done by manipulation, which can be done by a physical therapist, chiropractor, or osteopathic physician. Therapeutic exercises performed with the physical therapist or at home, and usually both, are very, very important. When these are addressed, when the diagnosis is taken from its initial stages to its logical conclusion, eliminating all the other possible sources of the pain, and then a treatment that will address all the components of the pain is addressed, the outcomes usually are very, very successful.